Um, my name is Brooke Cohen, and today I'm doing the Module 13 Voices discussion. So to start off, I'm going to be talking about a time that I witnessed ageism. So I work in a restaurant, Bonefish Grill. I'm a bartender and a server, and a lot of our clientele is elderly adults. Sometimes when elderly adults come in, I can see other servers or bartenders kind of treating them like they're dumb or don't understand what they're saying and talking down to them almost in a sense. So we had this lady come in and she had a walker and her husband was walking her in and they sat at a booth, and I saw another server go over to them and did not follow the correct steps to a normal table. You would typically go up and ask, are we celebrating anything? What brings you guys in today? Things like that. They did not ask that, and they honestly were quite blunt with the table. And then when the lady had questions, the server treated it like it was a problem and that she wasn't understanding and talking down to her. So that is an example of ageism in my own workplace. So then when we reflect on social work strategies, I think that social workers have a very big role in kind of helping these patterns of oppressions. So I think one key strategy would be advocating at macro level and micro level, so we can speak up for clients who are experiencing these discriminatory practices, and then also advocating for policy change that includes more accessibility. There's also education and training. These are really important. I think that social workers also have to continuously look at their own implicit and explicit biases and make sure that they're not applying what they feel into their work. And then there's also empowerment-based practice. I think this is really important because it can help kind of center clients' voices. You can recognize their strengths and you can validate their experiences. And then that also comes with not viewing the client as a dependent or incapable. And then also intersectional awareness. So acknowledging how ageism and ableism interact with racism, sexism, and classism to make sure that our services are all inclusive. Some questions I have, or some area that is confusing, would be that how can a social worker balance autonomy and protection? So when you work with older adults and people with disabilities, say a client were to have an idea or make choices that could potentially cause a risk, how can a social worker make sure that they are being safe without kind of reinforcing ageism assumptions? I think that can be a little bit difficult. Like, how can you tell an older adult, like, this isn't a safe choice without promoting ageism? So that would be my question, my story, and my social work strategies. Thank you.